I'm Joe Rogers, President and CEO of the Texas Heart Institute, and I'm joined here in the studio today by Dr. Ann Barnes, who's the President and CEO of the Episcopal Health Foundation. Dr. Barnes is an internist who trained in the Harvard system and has now been back in Houston for years and has dedicated her career really toward helping our community achieve a better lifestyle and a better quality of health. And so we're so happy to have you in the studio today, and thank you.
It's a pleasure to be here, Dr. Rogers.
Thanks very much. So I'd like to hear a little bit about what the Episcopal Health Foundation is thinking in terms of enhancing health in our community, and specifically around exercise. And then I'm also aware that you personally have made some commitments to movement and exercise, and you found ways to integrate it into your day. I wonder if you would make a few comments about that as well.
No, happy to do so. So, Episcopal Health Foundation has a tagline. It's health, not just health care. And so one of the things that we really focus on is considering the non-medical drivers of health, things that happen upstream that really impact a person's health. And so there are midstream activities like the lifestyle choices we make, eating healthy food, being physically active. And then there are far upstream drivers of health that actually influence whether we have choices to be physically active and choices to have access to healthy food. And so Episcopal Foundation is really focused on empowering communities to own their health, to tell us how we can support them in creating health-promoting environments. And so that's some of the work that we're doing with the foundation. In addition, we're talking to leaders at the state level on ways that we can actually further support using healthcare systems to connect people to outlets for healthy living.
I think this is such an important time in our history of health because we've really begun to switch our focus from taking care of illness to trying to prevent illness. And so I think that these concepts that you're describing where you're trying to move upstream into much more of a preventative mode are critical for us, and not just for us at the Texas Heart Institute in cardiovascular disease, but obviously in things like reproductive health and women's health. And there's so many areas of health that simply have not garnered the kind of attention that we should have been paying, I think, to prevent some of the long-term chronic conditions that we see today.
Right, and I think, my journey in this space began with me practicing medicine here in Houston. And I would see patients come in with the same constellation of conditions, high blood pressure, diabetes, obesity, and there was rarely any time to actually talk about what the lifestyle choices were and the environmental situations that led to those illnesses. And that's what really got me curious about what can we do on a larger scale to impact the lives of folks so that they can be healthy. And I've been really fortunate that I've been able to join others who believe similarly, and now being able to work with Episcopal Health Foundation with resources to really explore how can we do this well and how can we prevent disease.
I think that you've touched on something that's so important, and you've really begun to highlight the complexity of trying to guide someone on a very different journey that includes changing lifestyle. And it's difficult to do as a practicing physician where you have 15 or 20 minutes with someone to try to impart whatever knowledge you might have. But it's so complicated in that examination room because you actually have to have a deeper understanding of that patient's life, right? And so there's so much unfortunate time pressure in healthcare delivery that we need, I think, different kinds of models to really begin to change the trajectory of some of these illnesses.
No, absolutely. I was really fortunate when I approached my chair about my concern that there wasn't time to talk about lifestyle in the context of a regular clinical visit, that I had the opportunity to actually start a healthy weight clinic. And so that gave me the luxury of time to actually ask the questions about what's going on in your life, your home, your neighborhood, and how can we work together to create a pathway to you making healthier decisions. And one of the things that I found is that if we could figure out how to get the person walking, whether it was in their neighborhood, in a local park, or even in their living room while they were watching television.
Yeah.
I saw blood pressure drop. That was one of the earliest things I saw when I could get someone moving. And that really motivated me to think that this is where it's at. And this is really where we need to invest time and creativity, because we need to make that available to everyone.
So this ties in really nicely to the campaign that's starting now around Walk 30.
Yes.
And I learned earlier today that you have made some personal commitments to walking.
Yes.
And I want to explore just something else with you, and that is, we talk a lot about work-life balance, and it tends to segment our days into different tasks. But you actually think about it, I think, a little bit differently, and it's almost more like work-life integration.
Absolutely.
Or work-exercise integration. So maybe you could just give us some perspectives and give us some ideas about what you do during the day to promote health in your own life, especially around walking.
Well, I will say that today in our interview, I'm wearing tennis shoes because I want to be able to walk at any point in the day and never want my shoes to be a barrier to being physically active. I believe that Houston can be a walking city. I think we have a lot of resources, and there are investments ongoing to make those resources more equitable across our community so that everyone has access to a safe place to walk. And I think walking is wonderful because almost all of us can do it.
Yeah.
It typically doesn't cost any money. If you have a comfortable pair of shoes, you can do it. And I think our health benefits from that. And so I am really excited about the campaign that really pulls everybody in the city, including our leaders, around the idea that Houston can be a walkable place. And I think we're going to see incredible shifts in health as a result of that.
Dr. Barnes, thanks again for visiting with us today about the Walk 30 campaign. I appreciate it, and I look forward to working with you as we move forward with the campaign and try to bend the health curve for all Houstonians.
It has been a pleasure. Thank you.
Thanks.